So today we're going to do a cardiac assessment. I'm going to first start off doing hand hygiene, and I'm going to ask the patient to take off their shirt and shoes, and if they could lay down on the exam table. I'm going to pull out a footrest for them. Okay, so first I'm going to inspect and discuss locations and findings of the chest wall. So the apical impulse would be seen at the 4th or 5th intercostal space of the midclavicular line on the left side of sternum. I'm going to look for some lifts and heaves, and I don't see any. So normal adult heartbeat rate will be about 60 to 100 beats per minute. It's about regular, irrelevant, and irregular. So we have the base of the heart. It's found at the 2nd intercostal space on the right left of the sternum, and the apex of the heart is found at the 4th or 5th intercostal space, midclavicular line on the right side, line on the left side of the heart. So what I'm going to do is palpitate against the chest wall to look for apical impulse. Okay, so it's around this area. If you could just breathe in, hold it, and then exhale for me. All right, so I can feel that apical impulse. So now with the 4 major oscillatory areas, we'll be oscillating the heart valve sound. So let's see, we have the aortic valve, which is heard at the 2nd intercostal space to the right of the sternal border. The pulmonic valve, which is located at the 2nd intercostal space to the left of the sternal border. And then the tricuspid valve, which is 4th or 5th intercostal space to the left of the sternal border. And then the mitral valve, which is located at the 4th or 5th intercostal space, midclavicular line, left side of the heart. Okay, so now I'm going to oscillate those sounds. Alright, so the S1 and S2 are clear. I heard no extra heart sounds or murmurs. And your hands on the rest of the paper. Okay, so now I'm going to describe the oscillatory relationship between the S1 and S2. S1 would be the lub, S2 is the dub. S1 is the beginning of the systole, and S2 is the beginning of the distole. S1 is loud at the apex, S2 is loud at the base of the heart. S1 represents the closure of the AV valves, which is the tricuspid and mitral valve. S2 represents the closure of the semilunar valve, which is the pulmonic and aortic. So now I'm going to assess for like pulse deficit and oscillate for a carotid burn. So I'm going to start with the pulse deficit. So I'm oscillating at the apical impulse, and I'm going to palpitate along the carotid artery, okay? Alright, so they're exactly equal. There's no pulse deficit, so now I'm going to listen for carotid bruits. So I'm going to listen with the bell. Alright, if you could just take a breath in. Wait, wrong position. If you could, turn away from me. Alright, take a breath, hold it, and exhale. Alright, and then you can turn towards me. Do it once again. Take a breath, hold it, and exhale. Alright. So there's no bruise, and so now I'm going to start to palpate along your pulses, okay? So I'm going to move on to palpitating your pulses. I'm going to first start off with the carotid artery. Okay, and then your brachial, radial. Alright, and so the femoral artery usually is found in the groin area below the inguinal ligament between the pubis and anterior superior iliac crest. So now I'm going to go down to your feet and palpitate along the dorsalis pedis. Okay, and then posterior tibial. Alright, so for all your pulses are 2+ and equal bilaterally, so I'm going to go ahead and inspect and palpitate the lower extremities for any edema. And as I palpitate along your lower extremities, I don't feel any edema, so there's no edema noted. So now I'm going to move on to your nail and nail beds. If I could just see your hand. Okay, so your hands are about a warm temperature. Your nails are pink and convex, so I'm going to test for capillary refill. Right, so I'm going to hold down to your nail bed. Alright. Okay, so your capillary refill is good. It's about less than 3 seconds. And if you could, make a diamond for me. Okay, so the diamond, you have a diamond shape, which is good. I see there's no clubbing, and then also the angle is less than 160 degrees, so that's good. Okay, and that concludes our cardiac assessment.